Good evening. Thank you all for being here tonight. And for those tuning in at home, thank you for joining us. As the Director of Texas Health Resources, I'm hoping tonight's address will help put your mind at ease. As many of you have been advised, Texas currently has the first confirmed case of Ebola in the United States. On September 30th, 2014, we received notification from the Centers for Disease Control and the Texas Health Department that there is a confirmed case of Ebola. This case is located out of Dallas, Texas Health Presbyterian Hospital. When we hear the word Ebola, we automatically assume the worst. We have heard of the outbreaks in Africa, the death toll, the photos of the sick, and wonder if that's what will happen here. I am here to tell you facts that will prevent panic and help you and your families rest easy. I am going to start first with a timeline of events. On September 19th, 2014, a person coming from Liberia, a country located in West Africa, boarded a plane for the United States. One day later, on September 20th, 2014, he arrived on U.S. soil. The person in question, when on the flight, was showing no symptoms, which is why he was allowed to board. Please note that this is very important because Ebola is only able to infect others if one is experiencing symptoms. Early symptoms include fever, sore throat, and muscle pain. He was experiencing no symptoms during his flight. I will discuss more on symptoms later on. On September 24th, the individual became ill with symptoms. 2 days later, on September 26th, they went to Dallas, Texas Health Presbyterian Hospital to seek treatment. 2 days after that, on September 28th, the patient was admitted. The doctors and nurses at Texas Pres did their due diligence. They spoke to the patient about their travel history, assessed his symptoms, and then contacted the CDC, who then recommended testing for Ebola. The patient was then immediately isolated. As of right now, there are no other cases. The medical professionals and others he may have encountered when his symptoms began, roughly around 100 individuals. Out of precaution, we did cast a wide net. They are being monitored and isolating for 21 days, which is the CDC's recommendation for isolation and monitoring. While symptoms will begin anywhere from 2 to 21 days, most individuals present with symptoms within 8 to 10 days of exposure. His family has been advised to stay indoors, have no visitors, isolate, and monitor for symptoms. I would like to reiterate that those who are on his flight are in no danger, as he was asymptomatic at that time. Many of you may wonder, what exactly is Ebola? Ebola is a viral hemorrhagic fever. Symptoms begin mildly, almost flu-like. The one big difference is after a few days, symptoms will worsen. You will have vomiting and diarrhea. However, the telltale sign is a rash. It's a rash that presents in the upper arms and or legs. This is when the virus is in its later stages. You may be asking, what about the people who are exposed, who aren't his immediate family? According to the CDC, Ebola is not spread through casual contact, nor is it airborne. You would need to be in direct contact with bodily fluids. Bodily fluids include blood, vomit, or saliva. For example, the patient was noted to have vomited in the parking lot of his apartment complex. Those who were in contact, the paramedics who treated him, others who live in the apartment complex, are being closely monitored and isolating. How are we going to prevent the spread of infection? People do not spread Ebola until they become sick. During the first few days of symptoms, you are actually the least contagious. Moreover, there is only a 30% chance you will spread it to other adults in your household, and a 5% chance you would spread it to a child living in the home. Ebola is not spread through food, casual contact, or domestic animals. While the death toll in poorer countries is at 50%, it's been calculated that the U.S. death rate would only be around 10%. Controlling the virus requires every hand on deck. We need cooperation from medical services, which are your first responders, your doctors, your nurses, and your laboratory staff. We need community action, which is monitoring your symptoms if you've been exposed, keeping yourself isolated if you've been exposed. Rapid detection, meaning getting yourself right away if you've been exposed. We need access to laboratory services so we can isolate and treat you as soon as possible if you are tested positive for Ebola. We also need to make sure we provide proper care for the infected. One of the great things about our country is that we have all of the resources mentioned above to prevent the spread of the virus. We have enhanced surveillance for those in close contact. We can easily update the public through our webpage, www.tha.org/Ebola. We are also on Facebook. In addition, I will be holding daily press conferences until the situation is past us. You'll be able to rewatch any of the press conferences on the above website. We will continue to provide recommendations for healthcare workers on how to combat infection spread, and thankfully with technology, we can track close contacts of those who are infected and have them isolate and monitor. You may be shocked to know that the U.S. has been preparing for an outbreak of this type for about a decade now. While this is the first case ever reported in the United States, the virus was actually first discovered in 1976 in South Sudan, Africa. You may wonder who you need to call if you've been exposed and are showing symptoms. If you are experiencing headache, nausea, vomiting, and/or fever, and have been considered a close contact, you need to contact your local hospital. You also need to advise them that you are considered a close contact and feel you are experiencing symptoms of Ebola. Please do this before you head to the hospital. If this is a life-threatening situation and you have been exposed, immediately call 911. Before I end this evening's address, I want to take a moment to reassure our people of Texas not to panic. We have instilled every precaution to prevent the spread of Ebola. Patient 0 is receiving the best care possible. While I'm not privy to the specifics about his case, I am advised that he is receiving fluids to combat shock from blood loss. Other measures include pain management, treatment for anxiety, treatment for nausea, and treatment for fever. There is no approved treatment for Ebola at this time. We can only offer supportive care. With that being said, unlike other areas where medical treatment is difficult to find, that is not the case in Texas. We have some of the best and most dedicated medical staff right here. I have complete faith that everything is being done to prevent the spread of this virus and to treat our current patient. I will now answer any questions you may have.